Hello, hi, namaste. I am Dr. Neeraj, MD Homeopathy. I am working as a Community Health Officer, National Health Mission, and also as a District Internal Assessor, NHSRC, NQAS, Telangana. Also, I have been working with Dr. Jatin Walia sir in sports medicine. I will be dealing with sports injuries module, and so far we have discussed 3 topics in the sports injuries modules. And now we will be dealing with the last topic in the module, which is homeopathic therapeutics. So far we have discussed in the sports injuries modules, we have discussed about muscle physiology and biomechanics. Secondly, sports injuries. The third topic was role of physiotherapy and taping techniques, and now we will be dealing with the last topic of the sports module, which is homeopathic therapeutics. I have taken all these remedies from synthesis repertory, and all these remedies are the first grade remedies in different types of injuries. This particular topic is very important when it comes to sports injuries. Let us look into the outline of homeopathic therapeutics topic. We will be dealing with importance of injury management first, followed by ways of injury management, and then we would jump on to the introduction to homeopathic principles, followed by the topic proper, that is homeopathic therapeutics, and lastly we will be dealing with the summary. Now let us look into the importance of injury management. Now any injury if you take, it has to be managed pretty well. We cannot rely completely on medication. So even well selected remedies fail to act without appropriate management. For that matter, hypertensives need to follow the prescribed diet for the required effect, and if they fail to do so, the hypertension would not come down. So just as the treatment is individualistic, so is the management. So the management of every case should be done as per the individual. We cannot generalize the management for all the individuals in the same manner. It should be individualistic. Management and treatment should be done simultaneously to achieve a complete and a quick relief. Now let us see about injury management. We all tend to have injuries at some point in our life, and we miss out on how to manage those injuries. And now let us see how can we manage them. There is something called as Price's protocol. Price's protocol stands for P for protection, R for rest, I for ice, C for compression, E for elevation, and S for support. Along with the Price's protocol, we can also manage the injury by doing some bracing and support. Using braces, splints, casts, we can stabilize the injured area and we can promote the healing process. For example, when you have an injury to your elbow joint, it is not necessarily a fracture, it can be a sprain as well. So for you to stabilize the joint, you need to use a sling. If you use a sling, the elbow movement is stabilized and there is no further injury to the elbow joint. The next way of managing an injury is soft tissue therapy, and let us see what are the inclusions in soft tissue therapy. You can go with massage therapy, where the person tends to massage the injured area. You can go with muscle balancing techniques. Muscle balancing techniques helps to restore the balance and proper function of your muscles, and this can happen whenever an athlete has an excessive muscle soreness or an excessive muscle strain. Now, this mode of injury management would aid in a progressive recovery. Following the muscle balancing technique, we would have trigger point therapy. Trigger point therapy is a therapy which is applied to release the muscle knots. Muscle knots will usually develop when the sports person, without a proper seasoning, without a proper warm up or cool down, goes into the game. Whenever the sports person goes and plays without a proper warm up, he or she tends to work a lot in the game, and at some point there can be extra stretches that can happen in the muscle or the tendon. So, when the muscle is overstretched, it should relax for sure. During this process, there can be development of muscle knots. When the knots are developed, it has to be released, and they are released by trigger point therapy. This is usually done by a physiotherapist, and they are experts in that. Injuries can also be managed by physiological therapeutics like cryotherapy, hot pack application, laser, direct or alternate currents. It can also be managed by applying traction and also by taping and bracing supports. All these are usually done in physiotherapy. Injuries can also be managed by exercise or rehabilitation, which is again a very important aspect of physiotherapy. The exercise or rehabilitation is done by isokinetic contractions, proprioceptive management, plyometric exercises, and also loading with stabilization. Now, all these measures are done for a proper rehabilitation. And here in this image you would see the plyometric exercises. These are very important for a sports person to enter into sports. Now, before the sports persons to enter into sports after an injury, they should go through all these rehabilitation exercises and all these strengthening exercises. Without doing all the strengthening or rehabilitation exercises, it is impossible for a sports person to perform at his best extent. You cannot forget nutrition when it comes to injury management. Supplementation or diet to promote wound healing is very important. A proper nutrition would also help to decrease the irritation at the injured part, and it would also reduce the risk of complications. So, nutrition should not be forgotten when it comes to injury management. How can we forget about advice or counseling in sports injuries management? Advice or counseling includes sports psychology, pain control, and posture. An injured person should be counseled when he or she has taken a big blow, and it is very important to attend the counseling sessions. And I believe a homeopathic physician is best at counseling the patients, because homeopathy is a system which gives high importance to the mind symptoms. Homeopathic therapeutics. Coming to the introduction of homeopathy is a science which follows the principle of similia similibus curantur, which means likes cures likes. So, what causes the disease has a property to cure the disease as well, especially in dynamic form. Homeopathy is a wonderful system of medicine which bases on individualization. This particular system of medicine has an individualistic approach, meaning every patient gets a separate remedy basing on